Hey everybody. We've talked about the role of acetylcholine in autonomic and central nervous system functioning. Acetylcholine is a neurotransmitter that, when it binds to muscarinic receptor sites in the eye, heart, and digestive tract, will activate a parasympathetic nervous system response, what is commonly known as rest and digest. In the brain, acetylcholine has an excitatory effect, and we've seen that when there is an excess of acetylcholine in the brain, the symptoms of Parkinson's disease will manifest. Acetylcholine also has an important role in neuromuscular functioning. When acetylcholine binds to muscarinic receptors on smooth muscle, it opens channels on cell walls. Sodium and calcium flow into the cell, what we call influx, and creates an electrical charge. This electrical charge will cause smooth muscle to contract. The acetylcholine that causes this action is quickly destroyed by cholinesterase, the enzyme that breaks it down. Unlike adrenergic medications, direct-acting cholinergic meds tend to have more limited use. They are not as specific as adrenergic meds, since they activate only one type of receptor, muscarinic receptors. Muscarinic receptors are found on multiple organs throughout the body: the heart, eyes, GI, and urinary tract. In the heart, acetylcholine dilates blood vessels and reduces heart rate. In the eye, acetylcholine constricts the pupil. In the GI and urinary tracts, smooth muscle tone increases and motility is improved. Cholinergic meds tend to have more side effects than adrenergic medications. Indirect-acting meds are more common direct-acting cholinergic meds. They inhibit the action of cholinesterase and allow acetylcholine to remain in the synaptic gap so that muscarinic receptors can continue to be activated. Once the medications that inhibit the breakdown of acetylcholine is used in the treatment of myasthenia gravis. Watch the following video for one person's story about what she calls the snowflake disease.
My name is Olivia. I'm 19 years old and I have myasthenia gravis. Myasthenia gravis is a rare chronic autoimmune disorder that causes severe weakness of the muscles. Right before I turned 18, my legs gave out on me and my eyes started drooping, and at that point I knew something was really wrong. On April 14th, 2014, I was finally diagnosed with MG. They diagnosed me with a test called the Tensilon test, and basically when the doctor pushed the medicine through my vein, I was symptom-free for the first time in 3 years.
Actually doing it for longer than
It's already better.
you feel it?
Yeah, a little bit. Every 2 weeks, I get an infusion through my port, and each infusion lasts about 6 hours. Before the medicine starts, I get IV Benadryl to prevent any reaction, and it makes me sleep through most of it. I take 2 different types of medication for my MG. One is called prednisone, and the other is Mestinon. I take 2 Mestinon every 4 hours, and I take 1 prednisone once a day. All of these medications together help stop the production of antibodies and help prevent the breakdown of acetylcholine, which is needed for normal muscle function. The one comment that bothered me the most before I was diagnosed is when people would tell me to smile for pictures, but I just literally could not do it. The hardest part about having MG is that I wasn't born with it, so I know what it's like not to have constant weakness. My biggest support throughout this whole thing has been my family, my best friend Yasiel, and my boyfriend Jeremy. They've really tried to understand what I'm going through, and without them, I don't know what I'd do. Another thing that's helped me cope with my MG is having a support group on Facebook with others who have the same thing as me. This support group has helped me so much because it's nice knowing that I'm not the only one living with this. MG is also known as the snowflake disease because every snowflake that falls is never the same, just like every person with MG has a different range of symptoms. About a year ago, I decided to get a tattoo of a snowflake on my wrist. I see my snowflake every single day, and it reminds me how strong I am and how far I've come. I'm currently a sophomore at Santa Fe College, and I'm working on getting my AA in health sciences. My dream job is to become an occupational therapist because I know what it's like to be on the other side and receive treatment, so it's made me want to help others. One thing I've learned since having MG is I've come to appreciate the little things more, and I'm not going to let my illness stop me from doing what I want in life.
Myasthenia gravis, the snowflake disease, as it was referred to in the video, affects about 20 out of 100,000 people. It targets women in their 20s and 30s and men over 70. Myasthenia gravis is caused by a hypersensitivity response where autoantibodies are formed that attack and destroy receptor sites on muscle. Acetylcholine will usually bind to receptor sites on muscle and result in muscle contraction. Because receptors are destroyed, paralysis and weakness in certain muscle groups will occur. Diagnosis is established through the presence of symptoms and through conducting a diagnostic test with the medication edrophonium. The brand name for edrophonium would be Tensilon. Tensilon corrects the manifestations of muscle weakness. The destruction of the cholinergic receptors results in weakness that affects specific muscle groups, primarily eye and facial muscles. Clients can experience ptosis or drooping of the eyelid. They might also have diplopia or double vision. Chewing can become difficult. Weakness can also occur in the larynx and cause voice impairment. This weakness in the larynx can also result in aspiration. Less commonly, weakness can occur in the hands, and the person might have difficulty performing fine motor skills like writing. If the intercostal muscles are affected, myasthenic crisis, characterized by respiratory difficulty, may occur. Treatment is aimed at improving muscular function and decreasing the number of antibodies that destroy the receptor sites. Removal of the thymus, where the autoantibodies develop, can reduce the number of antibodies, although immune function can be compromised. Pharmacotherapy involves the use of acetylcholinesterase medications that inhibit the breakdown of acetylcholine. This will increase its availability to bind to muscle receptor sites and improve eye, throat, hand, and respiratory function. The medication therapy is lifelong. You'll recognize the medications used to treat myasthenia gravis by the suffix -mine, like pyridostigmine or neostigmine. Pyridostigmine or neostigmine is started at a low dose and then increased until symptoms subside. Eating becomes easier, and it's easier to raise eyelids. Common side effects include increased salivation and abdominal cramping. It's important to record when the medication is given and to know the time at which it is at peak effect. The client's meal should coincide with peak effect to improve eating and reduce the risk of aspiration. Teach the client the signs of overdosing: hypersalivation, extreme muscle weakness, diaphoresis, and respiratory difficulty. The client should also wear a medic alert bracelet. The signs of a worsening myasthenia gravis and an overdose of cholinergic medications are very similar. Excessive intake of cholinergic medications can lead to cholinergic crisis. In either case, hypersalivation, muscle weakness, bradycardia, and respiratory difficulty can occur. A dose of edrophonium is given. If symptoms reverse, then the cause is determined to be a myasthenic crisis. If not, then the client is treated with atropine. Atropine is a muscarinic receptor antagonist. It blocks the parasympathetic action of acetylcholine by preventing the neurotransmitter from binding to muscarinic receptor sites. Therefore, it has an opposite effect, a sympathomimetic effect. Atropine has a wide application of use. It can be used to treat bradycardia. In the respiratory tract, atropine decreases secretions and causes bronchodilation. When combined with the opioid diphenoxylate, it forms Lamotil, an antidiarrheal. Now here's a new class of medication for you. Neuromuscular blockade agents. They're also an indirect acting medication. They do not directly affect acetylcholine, but they bind to receptor sites in respiratory skeletal muscles. By blocking receptor sites, they interfere with the electrical charge that develops, what we call depolarization. Depolarization occurs when acetylcholine binds to skeletal muscles. Muscle contraction is prevented and paralysis occurs with the administration of a neuromuscular blockade agent. These meds facilitate the intubation process. They prevent the patient from fighting the vent. They have very quick onsets, sometimes as short as 30 seconds when given IV. They also have very short durations of action, somewhere around 2 or 3 minutes, just enough time to intubate. These medications are high risk. The patient is monitored constantly. Emergency equipment must be present since there is the risk for respiratory collapse. Edrophonium, the medication used to diagnose myasthenia gravis, is the antidote, and that must also be present, just in case the effects need to be reversed. Getting a complete medication history on intake is essential, since there are several med-med interactions. Calcium channel blockers and antibiotics can potentiate the effects of neuromuscular blockade agents. Loop diuretics that deplete potassium can prolong the action. Neuromuscular blockade agents can be non-depolarizing, like rocuronium. This med blocks the action of acetylcholine, so muscle constriction does not take place. The muscles become flaccid. Notice the CUR in the middle of the name. This medication is chemically similar to curare, a chemical used in poison darts by indigenous people of South America. Succinylcholine is a depolarizing agent. It binds to receptor sites in the muscle and prevents repolarization. The muscle remains flaccid. With succinylcholine, there is a risk for malignant hyperthermia. Succinylcholine can cause excessive metabolic activity in the muscle, resulting in tachycardia, muscle rigidity, and very high fever, the signs of malignant hyperthermia. Treatment involves the muscle relaxer dantrolene. When giving this class of medication, it is essential to assess vital signs, that muscle rigidity, apnea. Tell the patient and family that muscle stiffness can happen after surgery and can sometimes last up to 24 hours. Now, on to a new topic. Because the nerve gases, chemical agents used in bioterrorist attacks, can have severe cholinergic effects, I include a discussion of these in this lecture as well. I will also talk about biological and physical agents, how they affect the body after exposure. Some of these chemicals are widely available and are found in common products like pool chemicals and fertilizer. Let's start with the term emergency preparedness. The plans put into place to respond immediately to an emergency that threatens health. After 9/11, changes were made in responding to emergencies, which, after 9/11, included preparation for terrorist attacks that could involve chemical, biological, or radioactive agents. Nurses were expected to understand emergency response procedures, how to treat clients exposed to these bioterrorist agents, and how to prevent further damage to others. Nurses were also expected to be aware of the signs and symptoms of exposure to these threats. Finally, nurses are expected to be active members of an emergency team and maintain a list of contacts that include law enforcement, local health departments, and the CDC. There are 6 biological agents that are considered significant risks to national security because of their ease in transmission, high mortality rates, and need for special action. These would include tularemia, botulism, the pneumonic plague, viral hemorrhagic fevers, smallpox, and the one we're going to focus on here, anthrax. Anthrax is a bacterial infection whose toxins can be fatal. It is found in soil and might not do any damage unless it is unearthed. Once it is liberated, spores form that are toxic and capable of causing necrosis. Anthrax has been found in cattle, sheep, and goats. After 9/11, there were approximately 20 people exposed to anthrax in what was considered an act of bioterrorism. Anthrax can enter the human host through inhalation, ingestion, or through an open area on the skin. The cutaneous form is the most common. Fortunately, it's generally curable when diagnosed early. It's characterized by the formation of eschar. The GI form is very rare. It will usually occur after eating an anthrax-related piece of meat. The GI form has about a 50% mortality rate. Inhalation anthrax is the rarest of all 3, but tends to be the most lethal. It causes fatigue, fever, dyspnea, and persistent cough, very much like the signs of the flu. If left untreated, the person will die in about 1 week. Fortunately, there are medications that effectively provide prophylaxis when an exposure has occurred and that treat when an active case has been diagnosed. Anthrax is penicillin sensitive, so penicillins and other antibiotics that are similar, like erythromycin and gentamicin, are used when there are confirmed cases. Ciprofloxacin, 500 milligrams, every 12 hours for 60 days is given for prophylaxis. Considering that inhalation anthrax is so lethal, a combination of ciprofloxacin and doxycycline would be administered IV. There's been an anthrax vaccination available for about 3 decades now. It does have limited effectiveness and is given along with very time-sensitive boosters at 6, 12, and 18 months. Only specific populations, like the military serving overseas, receive the vaccine. Smallpox is a highly contagious and deadly virus with a mortality rate of 30%. It can be easily developed in a biology lab, and there are suspicions that there are stockpiles of the virus in various countries. Although it is usually transferred via contact, it can also be transferred through droplets. Smallpox first manifests with a high fever, fatigue, and backache. A diffuse rash appears and form pustules, elevated lesions that contain white blood cells and exudate. The virus exists in these pustules as well as in saliva, and the person becomes contagious once the rash appears. The only true treatment for smallpox is vaccination. So if a person were to be infected with it, they would be given antibiotics to prevent any opportunistic infections. The virus can live for years, so victims should be cremated. Toxic chemicals, such as those found in pool chemicals or organophosphates in fertilizers, are readily available and can be utilized to form compounds capable of causing severe disability or death. Among these dangerous chemical agents are vesicants that cause blistering and eventual cell death, and asphyxiants, which cause victims to gasp for breath and experience seizures. Nerve agents, such as sarin, have been used in chemical warfare and are capable of causing extreme cholinergic reactions. Watch the following video and notice not only the symptoms, but also the emergency treatment, which involves removing clothing and flushing with soap and water.
Monitoring groups say they're the telltale signs of a chemical attack: fainting, choking, and foaming at the mouth after what's believed to be a gas attack by Syrian government jets on a town just south of Idlib. According to the Syrian Observatory for Human Rights, at least 58 people were killed, among them 11 children under the age of 8. The head of Idlib's health authority has said there are 300 more who are wounded, claiming warplanes dropped either sarin or chlorine. A source in the Syrian military has strongly denied the allegations, insisting the Syrian army has never used such weapons and dismissing the actions as rebel propaganda. The footage was circulated on social media. In it are what appear to be members of the humanitarian group known as the White Helmets. They are hosing down children with water and performing CPR. A Reuters photographer witnessed the aftermath. His images are hard to dispute. The dead wrapped in blankets, survivors gasping for air. Monitoring groups claim warplanes struck again where the injured were being treated. It's not the first time the Syrian government's been accused of using chemical weapons. Western states believe it was behind the sarin attack in 2013, which killed hundreds. A report by the UN says it's used chemical weapons at least 3 times since. These latest accusations prompting France to call for an emergency meeting of the UN Security Council.
Or it might be useful when thinking about the effects of nerve agents to remember this handy abbreviation, sludge. The S stands for increased salivation. The L for lacrimation, tearing. Urination increases, as does defecation. Gastric disturbances, like abdominal cramping. E for emesis, vomiting. Altogether, they spell sludge. In addition to the symptoms listed on the previous slide, victims can also show the ones included here. Some other symptoms include sweating, twitching, and convulsions. Treatment involves the removal of clothing, flushing with soap and water, and cleansing objects with bleach and water. IV atropine, which blocks muscarinic receptors, is administered for 24 hours or until anticholinergic effects are seen, such as an increased heart rate, decreased GI motility. Radioactive material could be used in a terrorist attack as well. This material can be found in medical diagnostic equipment. The particles could either be released into public areas or as part of a dirty bomb, where the explosion of TNT disperses the radioactive particles. Injury can be sustained from external irradiation, where the outside of the body is exposed. You'll see the CDC recommended actions for external irradiation in the upcoming video. Contamination is the term used when the ionizing radiation enters the body. Immediate medical management is needed. Radiation sickness can occur after contamination, characterized by nausea, vomiting, and diarrhea that progresses to weight loss, anorexia, and myelosuppression. The only antidote available is potassium iodide after exposure, which helps prevent cellular uptake of iodine-131, what we call incorporation into the thyroid gland. The most susceptible organs to incorporation, in addition to the thyroid, would be the kidneys and bone. After treatment, the victim will need to be assessed for the development of cancer, since radioactive particles may be present for years. Thyroid cancer and leukemias are the most likely to develop. Now we'll watch the CDC video.
If you're outside in an area when a radiation emergency happens, you could be contaminated with radioactive material. Radioactive material can fall from the air and land on people, buildings, roads, cars, and other objects. This is called contamination. Contamination may look like dust or sand, or it may be too small to see. Radioactive contamination can spread in the same way that dust or mud can be tracked into the home or spread to another person or object. It's important to get radioactive contamination off your body as soon as you can to lower your risk of harm. Removing contamination is called decontamination. One of the best ways to decontaminate yourself is to take a shower. If you can't do that, remove your outer layer of clothing and wash your hands and face. Anything you can do to reduce the amount of contamination on your clothes or body will help lower your exposure to radiation. Here are some ways to clean or decontaminate yourself.
Take off your outer layer of clothing. Depending on how you are dressed, taking off your outer layer of clothing can remove most of the contamination. The less skin you have showing, the less contamination you will have on your body. Be very careful in removing your clothing to prevent radioactive dust from shaking loose. Put the clothing in a plastic bag or other sealable container and put the bag in an out-of-the-way place, away from other people and pets. Wash yourself off. If you can take a shower, take a warm shower and gently wash yourself with lots of soap. Do not scald, scrub, or scratch your skin. Your skin helps protect the inside of your body from radioactive material. Wash your hair with shampoo or soap. Do not use conditioner because it will cause radioactive material to stick to your hair. Keep cuts and abrasions covered when washing to keep from getting radioactive material in open wounds. If you cannot take a shower, wash your hands, face, and parts of your body that were uncovered at a sink or faucet. Use soap and plenty of water. If you do not have access to a sink or faucet, use a moist wipe, clean wet cloth, or a damp paper towel to wipe the parts of your body that were uncovered. Pay special attention to your hands and face. Gently blow your nose, wipe your eyelids, eyelashes, and ears with a moist wipe, clean wet cloth, or a damp paper towel. Put the used wipes, cloth, or towel in a plastic bag or other sealable container and place the bag in an out-of-the-way place, away from other people and pets. Tap water sources may be contaminated during a radiation emergency. If the tap water is contaminated, public health officials may recommend that you drink bottled water instead of tap water. You can still use tap water for decontamination. Radioactive material that gets into surface water or groundwater sources will be diluted to very low levels by the water and will be safe to use for washing skin, hair, and clothing. Washing with tap water that may be slightly contaminated is better than not washing at all. Put on clean clothes. Clothes in a closet or drawer are safe to wear. If you do not have clean clothes, take off your outer layer of clothing, shake or brush off your clothes. You may wish to cover your nose and mouth while you do this to keep from breathing in radioactive material. After you have brushed off your clothes, you can put them back on. Wash yourself first before helping infants, small children, or others who may need assistance. When assisting others, wear waterproof gloves and a dust mask or other material to cover your mouth if you can. Keep cuts and scrapes, both yours and those you are helping, covered when washing to keep radioactive material out of the wound. Wash your hands and face after providing help. If your pet was outside, you may need to wash them off as well. Wash your pet carefully with shampoo or soap and water and rinse completely. Wear waterproof gloves and a dust mask or other material to cover your mouth if you can. Keep cuts and scrapes, both yours and your pet's, covered when washing your pet to keep radioactive material out of the wound. Wash your hands and face after washing your pet.
If you think you may be contaminated with radioactive material, it's important to remove contamination from your clothes and body as soon as possible. Regardless of where you are, you can decontaminate yourself using any of the techniques we just described.
After wide-scale exposure to a bioterrorist agent, decontamination at a local hospital will occur. During the decontamination process, all access to the inside of the hospital is limited. Triage is conducted in tents outside. Floors are covered, vents are sealed. Inside the tent, strict isolation procedures are followed. Waste is double bagged or placed in plastic containers. Clients are flushed with soap and water, and the runoff is collected to prevent entry into local water sources. Staff wear water-resistant gowns, double gloves, and booties. They will also wear dosimeters, same as if they were caring for a client that is receiving radiation treatment for cancer. If the client has been internally contaminated, they will be administered a chelating agent that binds to the agent and excretes it through the feces. Samples of urine and feces and throat swabs are collected to determine the presence of internal contaminants. And that's our presentation on neuromuscular junction meds and on emergency preparedness. Thanks for listening.